Let's talk about some of the interesting opportunities. There's obviously, you can't read about healthcare law or the business of healthcare right now without hearing about value-based care and episodes of care. Tell me, how do you see telemedicine over the next couple of years intersecting with value-based medicine?
Telemedicine is here to stay, and it's going to be an integral part of healthcare. And its greatest value is providing greater access to patients at a lower cost. So a patient that may need a very brief encounter with a physician for an infection or the flu or a virus or a skin condition or a variety of other conditions that can be diagnosed and treatment without a face-to-face encounter can often be done much more conveniently for the patient, much faster for the patient, and much less expensive for the healthcare system. And that is the real promise of telehealth in our healthcare system. So you're substituting expensive ER visits and lengthy stays in the waiting room for the convenience of communicating with a physician at home, getting a diagnosis literally within minutes, and then having a prescription sent to your pharmacy if that's the treatment that's appropriate. Or just the peace of mind knowing that, hey, I don't have to go to the ER, I'm okay, to ride out the flu or whatever the particular diagnosis is. So that's the real, as I said, that's the real promise of telehealth, and that's really the direction the law is going as well, is how to make it convenient for the patient, profitable for the physician, savings for the healthcare system, while concomitantly avoiding the pitfalls and the opportunity for misuse of telehealth.
Mr. Morrone, what do you think is the biggest opportunity right now in the next 1 to 2 years with telemedicine?
Sure. Physician practices and hospital-based physician practices have a tremendous amount of opportunity in the telehealth space. In areas such as value-based care and episodes of care, where the ACO or the physician practice or the hospital-based practice is getting paid a fixed amount for a period of care.
So this is like a not fee-for-service, this is a fixed amount.
Yep, outside of the fee-for-service realm, where the physician or the provider is getting paid a lump sum, and their margin is predicated on how much they spend. So if they now can use telemedicine as opposed to face-to-face encounter, instead of having a patient come to the office, the two major upsides is it increases compliance, because now the patient's not going to miss an appointment, doesn't have to travel, can get that care in their home, and B, it reduces the cost so that the profitability of the episode of care increases. Also on the fee-for-service side, by integrating telemedicine, there are additional encounters that the physician can bill for fee-for-service that, because the patients don't want to come back or may be difficult to get the patients back, that they can schedule non-face-to-face encounters throughout their period of care. So that's additional revenue. They can also garner better outcomes by maintaining compliance with patients through the use of telemedicine. Also, in certain areas where patients are geographically distant. So for example, physicians in the Northeast where some of their patients are snowbirds and go down to Florida for several months, they can connect with those patients via telehealth and maintain a continuity of care and bill for that service. So there are just so many different areas where physicians integrating telehealth into their practice can improve the quality of care, reduce costs to the healthcare system, and increase their revenue.
It's So John, we talked about a lot of the hurdles of telemedicine, and that you have to obviously approach it knowing that there's federal and state law and insurance contracts that apply to doing it appropriately. But what are the practical next few steps that a physician would take if they want to use telemedicine?
Sure, and this is something that we do on a regular basis with our clients, is that the first step is to evaluate the practice, the environment that the practice is in based on state and federal law, their payer mix, how much is Medicare, how much is commercial insurance, and how they can leverage telemedicine in their practice, and do basically a feasibility study and help them to determine whether telehealth is right for them. And if it is right for them, is to then put in place the policies and procedures and the application of telehealth in their practice so that it's done in a compliant manner. And that we also will assist them in making sure that they get paid for the services that they're providing. So it's this sequence from feasibility through implementation and post-implementation monitoring of the payments.